It's hour number 2 of the Midday Buzz right here on TRAXX FM. My name is Anil on the mic, and as you heard in the promo, it's time for What Matters, where we discuss things that matters to all of us. And literally right now, there's something that matters to us, as the Ministry of Health has already publicly declared that by year 2040, Malaysia is moving towards becoming an aging population, and so it's very important for us to, understand all of the nuances and how we can, age well, we can live well, and feel great along the way as well. And to help us feel great along the way, maybe in the span of the next 30 minutes, we have a special guest in the studio. He's been here several times. We've often invited him to speak about many aspects of healthcare. And he is a consultant internal medicine from UITM Private Specialist Center, Dr. Hafa Harun. Dr. Hafa, welcome back.
Thank you, Anil, for having me. It's a pleasure to be back here.
Thank you very much. The pleasure's ours as well to have you back again in the studio. Maybe we can start off by you telling us from your clinical experience, what are the most common health conditions you see in older adults in Malaysia?
Yeah, so thank you for this question. I think the answer to this question is that there are two different types of ailments or illness, which is physical illness as well as mental health illness. So same goes with elderly people. They suffer from physical illness, so they suffer from mental health illness as well. So to answer your question, the most common physical illness for the elderly are the non-communicable disease like diabetes, hypertension, and high cholesterol. That would be the first group. The close second to that would be any cases of cancer or malignancy, and following closely as number 3 for the physical ailment, most common in the elderly would be musculoskeletal or joint problems. So that would be the answer for part A, which is a physical illness. As for the mental illness, it is equally important as well. So all of us, especially so the elderly people, are dealing with mental health illness as well. So the commonest one would be anxiety, depression, feeling lonely, depressed. So these are all things that has been described as taboo and not widely spoken of. So I think to answer your question, the most common health conditions seen in elderly in Malaysia are divided into two, physical and mental, and the subcategory were described as above.
Dr. Hafa, when you were describing and dichotomizing that earlier, the first question, you mentioned musculoskeletal.
Yeah.
I just spoke about something on radio a couple of days ago, a new trend among women who are going through menopause, of them running with vests on, because apparently there is this notion that women who are in menopause lose a lot of muscle mass, and so what they do is they go for their walks with a vest on. And then there are some groups that are actually saying that that's not so effective. What are your thoughts? How do you respond to that?
I think running with a weighted
vest.
Weighted vest or anything additional on top of your body weight to actually increase the calorie burn can sometimes be beneficial, but at times it can also be harmful as well. So the idea of you running or doing physical activity with more weight on your body is to actually increase the calorie burn. But in life, everything has to be done in moderation. So my advice would be, before you do anything or any physical activity, it would be good to consult the doctors or your physical instructor as to what will be the accepted weighted vest that you can actually take, so that you don't suffer the disadvantage of putting on too much.
Right. And how early should Malaysians start screening for age-related diseases like diabetes, high cholesterol, and kidney disease?
20 years ago when I started my practice, it was, life start at 40. So we were told that 20 years ago, all of us, when we reach 40, we should actually start screening for the common physical illnesses like diabetic hypertension and dyslipidemia. But now, nowadays, I think the answer to that, we usually start early, around age of 35, but if you have a strong family history of heart disease, kidney disease, diabetes, or you are you belong to the high risk group, which is you're overweight or you're a smoker. So then the age where you should be screened should actually be earlier by 5 years. So to answer your question, 35 for normal for those with no family history, 30 years old when you actually have strong family history.
Right. And what about patients who are above 60? And what are the things that they should be looking forward to? Do they, you know, come in with some worse symptoms if they just leave themselves unchecked, or what are your observations on that?
Yeah. So for those who are for those who are above the age of 60 years old, we usually look for the non-communicable disease like diabetes, hypertension, heart disease, but we should not forget cancer as well. Yeah. So in Malaysia, for men, prostate cancer and lung cancer are the commonest two cancer for men. As for women, breast cancer, lung cancer, and ovarian cancer are increasing amongst the women folk. So to answer your question, when they are 60s, we screen for the normal chronic illnesses like mentioned above, but should not forget we should also screen for cancer, depending on the gender. So the commonest cancers are prostate, lung, breast cancer, liver cancer, colon cancer, as well as ovarian cancer.
Right. Okay. Let's go in for a quick break, Dr. Hafa. When we come back, we'll continue with this conversation. Today on What Matters, I'm speaking to Dr. Hafa Harun. He's the consultant internal medicine at UITM Private Specialist Center. And Dr. Hafa today is speaking to us about having a general guide to healthy aging. What Matters on TRAXX Midday Buzz. It's Anil on the mic, and today with me in the studio is Dr. Hafa Harun, consultant internal medicine from UITM Private Specialist Center, and Dr. Hafa is speaking to us today about the general guide to healthy aging. Dr. Hafa, welcome back to
Thank you.
So now let's talk about lifestyle changes. What lifestyle changes have the most impact in preventing or managing multiple chronic conditions in elderly patients?
I think this question is quite important, not only for the elderly patients, but I think for all of us. So lifestyle changes that should actually be modified would be the way we eat, the timing that we eat. So basically, our dietary habits must be healthy. We should actually go for more food with fiber and reduce the food which is high in oil. We should also increase the number of physical activity. Yeah, so we should also make sure that we have enough sleep quality or quantity per day. Yeah, to actually give us a restful night rest so that we can function at our peak efficiency the next morning. We should also find a work-life balance as well. And then we must have our own mechanism of dealing with the stressful challenges that we face day to day in our life. Let's face it, life is just going to get harder, so we just have to get stronger. So we just have to come up with our own dealing mechanism on how to actually navigate the life challenges. So all of this are easier said than done, but I think as a general rule, we must always look for opportunities to improve our lifestyle so that we can actually lead a better life, so that it will actually help us to age gracefully and normally. Yeah.
And how do you help older patients balance multiple medications safely, especially when they have multiple health conditions?
Yeah, so this is something that we have seen over the years. As the person gets increase in age, they get more medical condition. A combination of more medical illnesses means a combination of more pills, right? So what we can do in the hospital, we can try to give them combination pills where medication for diabetic and hypertension can be combined into one pill. Medication for high blood pressure and cholesterol can be combined into another pill. So reduce the pill burden, right? So that is the role that the hospital can actually do. As for the role that patients and their family can actually take is to actually supervise the intake of the pills, by use of pill box. Segregate the pills that your mom or your dad needs to take on the daily basis. Put it into the, inside the box that is designated for the day. And then thirdly, not all medical condition that anyone suffers require pill medication. Sometimes lifestyle modification can actually be an alternative to reduce the pill burden. So I think to answer your question, medications are important, but sometimes there are other ways to treat the disease rather than medication. And all of this must be discussed with your doctors before you actually decide to actually change your medication.
Absolutely. And in your years of experience, do you see a gap in health literacy among older patients? And how do you think that can be improved so that they understand better to care for themselves?
Yeah, so I see a wide literacy gap between the elderly people depending on their location of where they stay. So those who are staying in big cities like Kuala Lumpur, Penang, JB, they tend to actually have more health literacy, right? So the first answer to that, yes, is depending on geographical area. Number two, it also depends on their education status as well. Yeah. Number three is whether are they living with the family members or any carers with them. So those who are in the rural areas, living alone, and those with low or they did not go to school at a higher level, these are the group of elderly people with the highest health literacy gap. And these are the vulnerable ones that we should actually identify so that we can actually help them to actually fulfill all the health requirements that they need, so that they will not be left behind compared to their peers of the same age and in a more urbanized area.
Now, how does aging affect the way common diseases like heart disease or infections present in the body?
Yeah, so for infection per se, we have a lot of scoring system where the elderly you are, the more severe will be the manifestation of the infectious disease. A good example is any pneumonia, lung infection, or even COVID, when they happen in an elderly people, is always more severe than those in the younger age group. So infection in an elderly people usually tend to present more severe. The explanation to that is because their immune system is actually downplayed, or the immune system is actually weakened as they get more senior in age. For heart disease, as they actually get more senior in their age, so because of the stiffening of the heart muscle, because of the stiffening of the blood vessel, so the heart disease become more accentuated or more severe. So the heart is already weakened because of the aging, wear and tear. So any simple minor heart attack can actually make the already weakened heart become even weaker. So to answer your question, aging basically reduces our general bodily function. So any further insult to an already weakened body tend to actually manifest with a more serious disease manifestation.
Right. Okay. Thank you very much for those insights, Dr. Hafa. We'll go in for another quick break. Today on What Matters, I'm speaking to Dr. Hafa Harun, a consultant in internal medicine at UITM Private Specialist Center, and Dr. Hafa is speaking to us on the General Guide to Healthy Aging. It's What Matters on TRAXX Midday Buzz. My name is Anil on the mic. And today I'm speaking to Dr. Hafa Harun, consultant internal medicine at UITM Private Specialist Center. And Dr. Hafa is today talking to us about the general guide to healthy aging. Dr. Hafa, now let's move on to the most talked about subject, which is exercise. But exercise for older people, especially for patients who are suffering from heart disease and diabetes, maybe like joint pain as well. So, what types of exercise would you usually recommend for people who are classified in this category?
Right. So exercise can actually be divided into many categories. So you have the cardio exercise where we just walk around, move around to actually increase your heart rate and burn calorie. Exercise can also be divided into low impact exercise and high impact exercises. So obviously, for the elderly people, high impact exercises will not be recommended for them, those with actually joint problems. So first, you identify where are the joints that are painful for the elderly people to actually exercise on, and then you can actually avoid that exercise. A good example was my late father. He had a stroke. His lower body was actually paralyzed, but he can actually move his upper body, so arms. So what we usually do is we actually put him on a wheelchair and ask him to actually push his wheelchair on his own, right? So the idea of exercise is to move around, move your muscle, and burn calories. So exercise can be done in many creative ways, in many innovative ways. So my short answer to it is exercise should be tailored on a case-to-case basis. If you're not sure what to do, you can actually come and discuss with your doctor or physical trainer. So the answer to that is exercise should actually be incorporated in our day-to-day activity. Make it a fun activity that you can actually do with your friends and family, right? And for those with joint pain, they can actually try doing exercise in a hot spring, right? Kolam air panas. I think there are not many here in KL, but I think the one closest to us will be somewhere in Batu Caves or Selayang area. There's also another one somewhere near in Uluyam, Kuala Kubu Baru. So you soaking in a hot spring, moving your joint can actually lessen the amount of joint pain. So my answer to that is exercise is important. Even with restriction that you mentioned earlier, it can still be done safely. But the most important part is to discuss what exercise regimen that will be beneficial to you, depending on the challenges that you face.
Another thing that I read recently, Doctor, was when you touch on joint pain, especially for people classified under having heart disease or diabetes, is also picking the right type of shoes as well.
Yeah.
Is there anything you wanted to say about that, Doctor?
Yeah, that's correct. Because if you're going to be exercising a lot or more on your feet, so the choice of footwear would actually be important. So if you're going to be walking for a long distance, so it should actually be a trainer or jogging shoes. If you're going to go, hiking or something which is more strenuous, so it should actually be shoes which is more appropriate. So shoes or footwear should be well padded, well cushioned, so that when you walk, you don't actually injure or causing an enormous amount of stress to your heel, right? So the answer to that will be appropriate footwear is something to cushion the impact of moving your legs for a long duration, so that to prevent further joint or irritation on the certain parts of your foot.
Yeah, that's something I've always advocated to many of my friends as well. Just, don't shy away from investing just a little bit extra money on getting good pair of comfortable shoes.
Yeah.
Because you'll thank your shoes later for keeping your feet and your joints intact. Yeah, Doctor. Now, what role do family members or caregivers play in helping elderly patients stick to treatment plans or healthy habits as well?
Yeah, so family members and carers are an integral part of elderly people to age gracefully, an integral part of them to look after their own health, right? So if they're staying together with their elderly family members, of course, they would naturally be eating the same kind of food, right? So the food preparation for the elderly our family members and yourself should actually be the healthy ones, right? So it will be difficult to actually create two different kind of food, one for the family member and the other one for elderly. So it's going to create conflict and comparison. So whenever you're staying with an elderly people with medical conditions, so the food preparation must be healthy and you must enjoy preparing it so that they would also enjoy in eating it. So that's number one. Number two, you should also ensure that your daily activities do not interrupt them in their routine, i.e. if they are gonna go to sleep early, you should also go to sleep early with them. Don't stay up late at night, disturbing your mum or your elderly relative by because of your staying up late at night. So you must also know what are the conditions that they are having. Go and see the doctor with them, get an understanding what are the conditions that your mom or your dad are currently having. Understand the timing of the pills to be taken, what are the pills for, what are the common side effects of this medication, and always check whether are they taking too much medication or not, because when we talked earlier about mental health challenges in elderly, sometimes they are a group of elderly people who wanted to harm themselves by using their own medication, by taking too much, by overdosing the medication, so that they suffer the side effects. Sometimes it can be a cry for help, a cry for attention. So the short answer to that: know the medication, know the side effect of the medication, and titrate and then monitor the medication if so that any side effects that can actually be picked up earlier should actually be picked up earlier. Yeah.
And from your perspective now, doctor, what does healthy aging really look like for the average Malaysian, and what's your best advice to achieve it?
Yeah, so all of us inevitably will undergo aging process. Some of us will undergo aging process prematurely or earlier than the others. So that is depending on a lot of factors. If you're dealing with a lot of physical stress, emotional stress, we tend to actually age quicker compared to our friends. If we are dealing with a lot of issues at work, issues with family, and we are suffering a lot of mental anxiety, we tend to actually get older quicker, so our body become weaker. So my advice is aging is something that is natural, but it should happen in a graceful manner. There are ways to actually slow down the aging process. So the ways to do that is to actually embark on a journey of lifestyle modification. There's a very famous Chinese idiom that has been converted into English. They say that a journey of 1,000 miles starts with the first step. So basically, aging is a journey of 1,000 miles. So the first step is to actually modify our lifestyle, make sure we are doing healthy life choices, and then stick with it, get help, and mix around with people so that you have peer support and motivation to continue doing it. Yeah. And don't do it alone, because we are always stronger in a pack.
Right. Okay. Dr. Hava Harun, thank you very much for setting aside your time over the last 30 minutes and giving us some fresh insights on understanding how we can age much better, live well. Before I let you go, any final words for the day?
I think this topic is a huge topic. There are many issues that I would like to touch on, but because of the time constraint, I hope my explanation is illuminating enough. And for me, remember the 4 M's of dealing with life challenges. The first M is meet people. Don't stay alone. Don't suffer in silence. Meet people. The second M will be move around. The third M will be make something. If you enjoy doing something, so you make out of it. If you enjoy cooking, try a new recipe. If you like to play sports, so make something. and the other M will be meditate. Tell your mind to calm down and relax yourself. So these are the 4 M's that I personally practice, and I would like to advocate so that we can actually have a better health, life balance, and to actually improve our mental health and also physical health as well.
Sure. Dr. Hava, it was such a pleasure talking to you. Thank you very much. We look forward to having you in the studios again. You take care.
Thank you for having me. Thank you so much.
You're welcome.